Okay. So okay, thank you. Okay, good morning, everyone. For some of you, maybe it's already lunchtime, but still very nice for you to come and be here. This is one of the new webinars in the webinar cycle of the Cost Action Net for Age Friendly. We have been approaching different themes. Today, we will be discussing standards and certification connected to eHealth apps on one side, on the standards, and a certification for smart homes. For this purpose, we had a very positive agreement from our speakers to share their knowledge with us. We already thank you for this. We will have Silvia Urra and Regis Decorme speaking about, speaking about the certification of Homes for Life, which is a project that develops a certification toolkit for smart homes. And then we'll have Petra Hoogendoorn from the Leiden University presenting us the current smart standard that is being developed on eHealth apps. I will ask you once again, sorry if it is possible to keep muted, because otherwise it will be difficult for hearing the recording later on. So I will pass the floor now to Regis and Silvia. They both will make their presentations. And if you need any help, please just let us know. Silvia, Regis, very nice of you to agree to come here. I hope you enjoyed as much as we will. Thank you.
Thank you very much, Karina. Can you see my presentation? Is it okay? Yeah. Okay. Thank you very much, Karina Bileke, for inviting us to this webinar. Sorry, someone is, please, if you can mute your microphones. Thank you. So as Karina has said, during the last 2 years and 3 months, we have been working in a project called Homes for Life that has been funded under Horizon 2020 program. And I will go briefly across the project so that you see how we develop the certification scheme, and afterwards we will explain more specifically the certification scheme. So the Homes for Life project, okay, it started in December 2018 and it has a duration of 27 months. It finished this February, and we have the consortium was formed by 9 partners from 5 different European countries. We were 2 research centers, Tecnalia, where I am from Spain, and TNO from the Netherlands, 2 universities, Utrecht University and Università Politecnica della Marca from Italy, 2 private companies, Certibea, that is a certification body that has been involved in all the development of the certification scheme, and R2M Solution, where Regis works, and he will explain us better what they do. And then 3 different associations, the ECTP, that is the European Construction Technological Association, representing the biggest amount of stakeholders from the construction sector in Europe, Age Platform Europe, that is representing the biggest number of associations of older adults across Europe, and Eurocares, that is representing the informal cares. So this is like a kind of a scheme of the project, and I wanted to put it so that you understand what have been the beginnings of the project and how we did achieve the certification scheme. We had 2 different work packages that were more like technical. The first one was work package 2, that the aim was to develop the Homes for Life vision and working taxonomy. And what was done also was to analyze the different contexts in different European countries regarding age-friendly housing. And it was also done an analysis of innovation projects and initiatives across Europe regarding age-friendly housing. Then we developed the working taxonomy that was a structure of what a home should have to be considered a home for life. And then on that basis, we defined the Homes for Life model. And what we did also was analyze different certification and labeling schemes that were existing. And also we analyzed different research and innovation projects that were ongoing. And with all that information, what we did was to develop the Homes for Life certification scheme, okay? So the main outcomes of the project was the Homes for Life vision. That was a document that wants to see how the future has to look like for age-friendly housing, and wants to provide guidelines and tools for stakeholders that have an idea to develop business or to launch policies about age-friendly environments. Then we did develop the taxonomy and KPI definition methodology. So it wanted to explain what it means for a home to be age-friendly, and the KPI framework uses the taxonomy as a structuring principle. And then on all that basis, we did develop the Homes for Life certification scheme, that the intention is to be applicable for all Europe, and it's based on a long-term vision of people's needs and requirements, and has a holistic life course approach. So with all this information, we did develop the certification scheme. There are some deliverables joined to the project that can be downloaded from our webpage. They are not yet there because we are waiting for the approval from the European Commission. But as soon as we have the approval, you can download, all the information that is that is developed in European projects is public, so you can just check it. And now I will try to go briefly across the certification scheme. Well, for the elaboration of the technical reference framework, the objectives was to take into account the characteristics and to ensure the quality and validation progress to get to the final version. So we took as sources the functional brief, the working taxonomy, the key performance indicators, and the innovation analysis. And the result was a technical reference framework, test and improve on demo sites, and the definition of the validation project with the process with the pilot sites. So as I have said, the basis was the taxonomy and the KPIs. We had more than 220 KPIs, and we did define on the basis of the taxonomy 5 different clusters. Well, it's 6 because one is related to management, but let's say that it's like 5. So we did work on the personal, social, economic, physical, and outdoor access clusters. In the personal, we have 2 subcategories that are identity and emotional connectivity and privacy and dignity. In the social, we have social activity and employment. In economic, we have affordability and choice. In the physical, we have personal safety, comfort, accessibility and orientation, health and social care, and smart readiness. And in the outdoor access, we have home and building, immediate environment, and neighborhood or village. And apart from that, we have the context analysis, the requirements that finally in the certification scheme were reduced from the KPIs to 100 requirements, and the service to the inhabitants or future inhabitants of that home, let's say. Let's see. So for the validation of the certification scheme, what we did was 2 series of tests in different 10 pilots on 6 European countries. We organized some webinars and call for comments. And with that, we had the final version of the technical reference framework, and we implemented it in a tool called ISIA, that is the tool that 30BA uses for the other certification schemes they have. The improvements between the first version and the final version we have after the pilot cases, we did, let's say, improve on the definition of the building types and perimeters. We have individual houses and collective buildings, the occupancy situation, not yet in use or in use, and the life cycle phases. You can assess buildings in design, under construction, or in operation. The certification process is followed like this. You can test or you can assess buildings that are not in use, that they are on the retrofit, renovation, or rehabilitation process, or under construction, new construction, or you can test if they are in use. And also the validity of the certificate changed from the first version we have to the last one. So finally, from the 220 KPIs we had, we reduced it to 100 because the pilot cases told us that it was very complex. So now we have in this version, we have 26 requirements in the personal cluster, 21 in the social, 9 in the economic, 43 in the physical, and 12 in the outdoor access. This is the service that were defined for the residents, and they have quite a big weight in the scoring of the final scoring of the certification scheme. This is like the general structure. So as you can see, the certification scheme, the scoring gets from the requirements and from the service. And apart from that, we have a context analysis with the site assets, the client's commitment and involvement of stakeholders. And in the requirements, we have quantitative and qualitative indicators. We have 14 categories in 5 clusters, and they have the 80% of the final score. The 48% is super cluster 1, that is involves a personal, social, and economic cluster, and 32% is super cluster 2, that is physical and outdoor access. And the surveys have the 20% of the final scoring also. You may see that we have given more weight to the supercluster 1, that is personal, social, and economic cluster. That is because we have found that are the clusters that are less taken into account in the existing certification schemes. And also because we think that many things that are included in the supercluster 2, that are physical and outdoor access clusters, are already covered by the laws and legislations in the different countries, that are all those things referring to accessibility, habitability, indoor comfort, and these kind of things. So we developed also some awards, and we did change, because to be certified, you have to get at least the 60% of the scoring. So if you have 60%, you're good practices. If you are until 75% very good practices, and if you are 90% or more best current known practices. This is the pilot cases where we did test in the different European countries. You can see there the ones that were tested in design phase and the one that were tested in operational phase. And this is the different pilot cases we had. So with the pilot cases, what we did was to validate the certification scheme using evaluation forms, different comments on the platform GCA, interchanging different discussions with pilots, and then we did also a webinar and a call for comments. And please, Regis, if you want to jump in.
Yeah, thank you very much, Silvia. Thank you for the invitation. So I'm Regis from R2M Solution Research to Market. So we were indeed our company, a partner in the Homes for Life project. And so you understood that the European project is now finished, is now completed. But then we are really moving to the market with this new certification. So that's why we will continue being involved to now market this product. So I wanted to perhaps spend just a bit more time on highlighting our various pilot cases that Silvia already presented, just to show that they are very, very diverse. And each of them is very interesting and particular. And so, for instance, there you can find those leaflets on our Homes for Life website, where each pilot is presented through a business case. And so this one is in Nice, in France. So it's interesting because it's a large building which is made to be cross-generational. So it means you've got a school, you've got a nursing home, you've got apartments, all of them combined into this large building with common facilities. You can go to the next one, Silvia. We've got another pilot, for instance, in France, which is near Bezy. So it's a small village near Besançon. So here it's a different model. It's a small residence with digital service for older inhabitants. So this one is also in design phase. Then we've got pilots in Spain. So you see here it's different because the building is already in use. So the certification, as Silvia already mentioned, it can be applied both during the design phase or during the operational phase. So this example, it's in Bilbao in Spain, and it was very interesting. It's assisted apartments for persons with functional disabilities. And really co-design for these apartments was at the center of the design phase, basically to redefine the way they're set up and to make sure that they fit with the inhabitants' particular requirements. You can go to the next one, Silvia. We've got another pilot in Spain, again in design phase. So as you can see, different really also in terms of surface, this one is quite large, and here it's the idea, it's the concept that they promote of a self-managed collaborative space for the elderly. We've got a pilot in Poland, also completely different from the others. Here it's kind of living lab. It's a model apartment which is used as a test bed really to experiment innovative technologies for active and healthy aging. And so this one has been also certified according to the Homes for Life certificate. You can go to the next one, Silvia. We've got another one in Poland. This one in Lodz is interesting because we show that our certification can be applied as well in a context of refurbishment. So here it's a building which is very old. Actually, it was built in 1896, and so it has been refurbished into also this idea of a multi-generational house. And then we've got some more pilots. So the one in Italy, which is there, it's also a renovation project. On the next slide, Silvia, we have one in Ireland as well, which is designed by an architect. And it's called Housing with Supports. And finally, one example in the Netherlands, Die Oggewijk, and there it's a focus, it's a design project for inhabitants suffering dementia. So it's a bit, again, quite particular. So all that to show that really the challenge when we developed the certification was to get really a European certification, because perhaps you are already aware of some national certification that exist for age-friendly environment, but we wanted to develop something which build on them, but which also can be applicable everywhere in Europe to different typologies of buildings, and also which fit with the way we live. And of course, it's different depending on each member state. So on the next slide, yeah, we see like a picture to show that this certification, we expect that it is going to work just like any other certification. So probably you are familiar with those certifications which relate more to energy efficient building. But here we believe it's the same, that the future is for age-friendly buildings, and that will give value to your home or to your property. So we have the same kind of, let's say, marketing arguments in terms of when we are getting in touch with real estate companies. And so you can go to the next one, Silvia. We indeed develop a kind of similar certification package that will be delivered to those real estate companies willing to implement the Homes for Life certificate. So of course, they will be able to show that they have been certified. And on the next one, yeah, it's Silvia mentioned that in the partnership of the EU project, we had actually 2 companies involved, and their business is really already to manage certification. So we have Certivea and their international subsidiary, which is called Serway. So they will be one of the manager of the Homes for Life certification now that we are entering into the market. And Tecnalia Certification as well, which is also a subsidiary of Tecnalia, the research center, which also will work hand in hand with Certivea to manage the certification, meaning that they will work on the update to make sure that the certification evaluation framework that Silvia presented, it's going to remain updated because it has to, it's something which is living, of course. And next, so just to show that Certivea, for instance, this is their portfolio of certifications. So again, they are already very active in this area of building certifications. They have ready to service, so it's certification on smart buildings. They have HQE, I'm sure you are aware, it's more on energy. Osmose, which is more into well-being into buildings. And of course, there are connections with the Homes for Life certification. So it means that a real estate company, they can apply to HQE, potentially to R2S as well, and then Homes for Life. So it's something which is not independent. They work well together. And then just to focus on R2M, my company. So we are present in 4 countries. So in Italy, in France, Spain, and the UK. And for us as well, we are already very active in the field of building certification because we provide trainings and we do the on-site assessments. So that's the next slide. You can see these are the labels we are already working on our side. So BREEAM, LEED, WELL, also on well-being, Wired Scored, which is also about smart buildings. And so we are now adding Homes for Life into this portfolio. And so it means we will support and the building owners, the facility managers to implement the Homes for Life certification. We have a good list of organizations that are already supporting us and which are listed there. And it means that the work is already going on. So these organizations, they have been following us during the project phase, and now they are engaging with us to start certifying their buildings according to the Homes for Life scheme. And the last slide, it's there are different ways to work with us, and we are really open for partnerships. So the first idea, of course, is very straightforward. If you own buildings, or if you know an organization that would be interested, you can now get your buildings certified according to the latest version of the Homes for Life scheme. There is also an opportunity if you are interested to join the advisory committee of the certification. So it will be a scientific committee that Certivea and Serway are going to launch, and basically the role of this committee will be to make sure that the evaluation framework which is used to certify buildings, it will remain up to date. So here again, if you are interested, get in touch with us, because we welcome your participation in this committee. And finally, we also want to extend our network of trainers and assessors. So you saw that my company, R2M, we will be active in that field, but we are not present everywhere. So typically, if you are present in a country where we are not represented yet, and if you feel that you would be relevant and interested to provide trainings or to do the on-site assessments of the buildings, then also contact us, and we are happy to discuss your inclusion in the network of Homes for Life accreditors. And I think that's it on my part. Silvia, perhaps I let you the word.
Yeah, no, thank you very much for your attention. If you want to get more information, you can contact us, or you can also contact Hervé Duret, that he's from Certivea, and he's the one that is now, let's say, in charge of the certification scheme management itself. So feel free to contact him if you want more information, or either Regis or myself. So thank you very much.
Thank you.
Thank you, Silvia. Thank you, Regis. I am sure that there will be a lot of questions for you after Petra's presentation. For sure, I already have one or two. So I would thank you for being here, and also for keeping with us until the end. I would now pass the floor to Petra. I don't know, well, just so that you know, Petra was stuck in a bus queue, in a car queue, sorry, and I don't know if she already got home, but if not, she said she would still present it, and Willeke will support her with the PPT.
Okay, so I decided to be on the safe side and take part.
Okay. Okay, thank you so much then. I think Willeke will then support you with the PPT.
Hello.
And thank you so much, Petra, for being there and even in the car to present this. This is the real life for sure. Thank you. I will then give you the floor and leave you to present the standard that we all want to know about. Thank you.
Thank you. Well, thank you for inviting me to speak about CEN-ISO 82304 Part 2 on behalf of CEN-TC Technical Committee 251. My name is Petra Hoogendoorn. I'm a patient advocate, initiator of 2 health hubs in oncology, and a researcher at the National eHealth Living Lab, Leiden University Medical Center, the Netherlands. I've coordinated 82304 Part 2's quality requirements conformity assessment and health hub quality label, which I'll tell you more about in a bit. As an independent expert, I assist organizations in using this standardization to put health hubs to use. Next slide, please. Yeah, our project is an industry-supported initiative of the European Commission, DG Connect, part of pillar number 3. Very small print. I'll explain it to you. Pillar number 3 is about facilitating supply of innovative digital-based solutions for health, also by SMEs, with common principles and certification. We've strived to have our work contribute to the other actions, support demand uptake by healthcare authorities and providers in care pathways, and mobilize more efficient funding or reimbursement by health insurers, as Germany is currently pursuing with the DiGA legislation. It supports what EU citizens expect. Next slide, please. Being able to share their data, which can indeed enhance quality and accessibility of health services. A 2016 US study revealed having cancer patients monitor their symptoms on a weekly basis in an app and adequate follow-up by a nurse resulted in an increase of median survival with 5 months, more quality of life, and less hospitalizations. Patients with less computer skills benefited more. Unfortunately, it is not yet clinical practice. Both the great apps and the crappy ones largely remain undetected. So we're trying to have the great ones, make them more visible and have them used more in healthcare, but also by citizens to support their health. The fact that it's not yet used is at a financial cost, which is quantified at billions a year EU-wide. Next slide, sorry. And again, next slide. And at a loss of for real actual people. My late husband died of a brain tumor in 2012, and he would have loved to have had 5 more months with our 3 young kids in better quality of life with less hospitalization. So next slide. Among the key adoption barriers behind the current situation are a lack of clarity on mHealth certification. Click. You could click. Yep. And click again. I have a few clicks here, sorry. And again, I click. Yeah, a lack of reimbursement mechanism, and last click, a lack of awareness of mHealth benefits among both health professionals and patients. As I mentioned before, our work is both geared towards patient care and to citizen empowerment, which is something that the EU has both stressed. Next slide. Yeah, patients and carers indicate the sheer number of health apps makes choosing them confusing. They are not sure health apps will help them. They know of no health apps relevant to them, and they are suspicious of health apps because they don't know who makes them and prefer face-to-face consultations. Next slide. So who do they trust to recommend health apps? Australian consumers said they would trust the Google search and the App Store least, and GPs most in recommending apps. In reality, however, they are mostly forced to do with Google searches and the App Store or shy away from health apps. Next slide. As indeed, research shows the ranking in app stores, click, ratings, click, and descriptions, despite the use of scientific language, do not reflect quality well. Next slide. Yet GPs, again Australian, acknowledge they don't know which health apps are effective either. They lack a trustworthy source. Next slide. And thus rarely prescribe apps. Next slide. European health professionals lack a trustworthy source as well. The app repositories in several European countries have generally only assessed a few dozen health apps with frameworks that are often not transparent. A 2016 industry study indicates at that time the number of health apps was already 325,000. Next slide. This 2018 WHO study of 20 app assessment frameworks in search of a common framework for Europe was presented to the EU in 2018. And the good news is that our work qualifies best click in all criteria used then. Click, could you click? Yeah. It covers all the domains such as privacy, transparency, safety, etc., and ethics. Click. It involved 8 stakeholders versus at most 3, adding consumers, payers, app stores, and app assessors. It takes the whole life cycle into account, which none of the 20 frameworks did. And last click, we studied more than 50 versus at most 2 existing frameworks and reference some 35 versus at most 18 standard organization. That's the last click. Yeah, and the next slide. So in our project, we've made a health app quality label, which is inspired by the EU energy label, click, for both the apps that are medical devices and the 79% that are, according to Dutch research, not medical devices. The EU energy label, also a standardization effort of CEN-ISO and IEC, is very effective with 85% of customers click recognizing it. Sorry, not a click. And using it when purchasing, and 59 countries outside of Europe having adopted it. We've tested the health app quality label with people with low health literacy for adequate understanding, as 1 in 2 people in the EU have low health literacy, and research has shown what works better for them works better for all of us. In the label, scores ranging from E to A on healthy and safe, easy to use, secure data, and robust build are presented. They add up to an overall health quality score. The app's name, icon, available platforms, app manufacturer, benefit of the health app, when to contact the health professional prior to using the app, and date the app is last checked are displayed too. Like the energy label, the label has a header with either a flag or logo. Next slide. We've tested in an App Store context comparable to EU legislation as of March this year that online sales of appliances such as washing machines require a digital version of the EU energy label with a nested label close to the retail price. So that only shows whether it's an A to E, and that if clicked or hovered over reveals the full label. Next slide. These were the results of an EU Commission study. What do patients and carers need in health apps but are not getting? They want apps with trustworthy information that are easy to use, have secure data, and work effectively and consistently over time. Next slide. They are reflected in the 4 quality aspects in the label: healthy and safe, easy to use, secure data, and robust build, which are the result of a comparison of 13 health app assessment frameworks. Healthy and safe includes health requirements, health risks, ethics, health benefits, and societal benefits. Easy to use, accessibility and usability. Secure data, privacy and security, and robust build, technical robustness and interoperability. Next slide. App manufacturers are asked to fill out, the at most 67 weighted yes, no, not applicable questions within the 4 aspects. Click, please. And another click. The yes answers require evidence that is assessed by an independent expert app assessment organization cost effectively at major changes and repeated based on health and privacy risk. And the conformity assessment was developed with a Delphi study, which is a consensus study with 90 experts from 8 stakeholder groups from 6 continents. Next slide. It was tested for the Dutch Ministry of Health with 11 COVID-19 symptom apps and referenced in the EU toolbox for COVID tracing apps. We've also made a health app assessment framework for the Dutch Ministry of Health based on CEN-ISO 82304 Part 2 already. Next slide. Nearly there. Good to stress that an A score in a label is not a goal in itself. Similar to the quality requirements of a mouth mask in a Rotterdam metro not being comparable to the requirements for a mouth mask in an ICU in Milan. Also, if all labels would be green or red, that would not be very helpful in decision making. Next slide. Our final draft is now in a ballot until the end of this week, preceding publication of the technical specification in the second half of 2021. And CEN and ISO and IEC members are voting in parallel, so all standardization organizations from different countries. Next slide. Thank you for your attention, and happy to answer any questions you may have.
Thank you so much, Petra, also for the presentation and the tough environment to do it. I think it was very clear. And I think also it's very encouraging to see that between what Silvia and Regis presented and also you, there seems to be some consensus in the way people will read the certification at a certain point, because the things are simple to see, they are colorful, we can understand how to move along it. So it's good, I think, to see it going in the same direction. So if you agree, I would now open the floor for questions. Usually in these webinars, we try to encourage people to speak directly and not necessarily put it in the chat. So please feel free to put your camera on and ask Silvia, Regis and Petra wherever you think it's necessary. I for sure have some questions if we have shy people here, but please go ahead if you want. Just unmute and pop up. Liz, I see you raised your hand. You can just unmute and ask, please. Go ahead.
Well, both of them were extremely interesting presentations. I had heard of Homes for Life because Age Platform is involved in it. So, but it was still better to read it. I mean, I did not know, frankly, what I can do with this information, because in each country we have very, very different patterns of ownership, patterns of staying in the same home, and so on. And I suppose one comment I have is that in many countries, older people stay in their home throughout a long period towards the end of their life. I would like to ask some questions. I can't ask the questions, but I would like to think about, what are you doing to influence architects, planners? What could we do to influence architects and planners to make adaptations of homes, to make them homes for life? People will not change houses, okay? And you have to recognize that they don't want to spend a lot of money sometimes. But I think that's one question I have about how we can adapt existing homes where people are going to stay because they live near their families, they know the neighborhood, there's a million reasons. I can't see, it's only in some countries like Germany where people, and I think France, where there's a lot of movement in older ages, but really there's not a lot in many other countries. That's one question. And then the other one was to Petra, which I thought was fascinating. That's the first time I'd actually heard about this. I've been looking for somebody to tell me about this, is really what is available, what's online, what's worth talking about. And where do I find this list? I've got the name, the number, but where do I just look it up under the number? And can I then find it and see what's available in Greece? Because I have to tell you, a lot of things are just not available here. And I mean, AAL things are just not available, just not available. So are these standards available in my country, not in general? Sorry, that was two questions, but that's fine. Thank you.
Thank you so much, Liz. Okay, maybe the second one is simpler. So maybe Petra can already answer you, and then we can go back to Silvia and Regis for the first one.
Yeah, as I mentioned, the standard is currently invalid, which means that the countries are deciding now, after having had 4 drafts, whether the final draft is good to go. So if you Google it now, you will find that it is in progress. We hope it will be published in the summer or second half of this year. And then, of course, there's going to be a next project to implement it. So the EU has been looking for a common framework. That's not the case yet. We have made a framework now for the Netherlands based on CEN-ISO and given them advice on how to operate it and indeed make it more visible. So, for optimally, you would know when you look on the Google Play Store or on the App Store, have this label available. But there might be app libraries as well, or apps can be part of GP websites where they advise you to do certain, have to use certain apps or have other health interventions. So those are the next steps. So far, we've only checked 11 symptom apps with the previous version of the standard, so there's a lot more to do to make sure that you can actually have these labels for all of these apps, because there's a lot.
Yeah, maybe we can take the chance to ask you, Petra, when there are some news and this is approved, if you can let us know. I can also spread the word amongst the network, because I think this interests a lot of members. Okay, thank you so much. Silvia, Regis, I don't know who wants to answer the other question from Liz.
I can start, and Regis, if you want to. Well, Liz, you have done the biggest question we have. What can we do in Europe with the building stock we have that is quite old, with a lot of issues regarding accessibility that are so difficult to solve, because accessibility was supposed to be something that should be overcome already, but it is not. And in some cases it's not possible because the buildings are quite old and the situation is difficult. Of course, the Homes for Life certification scheme is easier to implement if you are just starting a new building or if you are retrofitting a complete building. It's more difficult if you want to do that from a particular owner point of view, because of course, also probably a lot of things that we consider that should be taken into account does not depend on the owner of the building, of the home itself. But at least we give some guidelines of things that has to be taken into account. And also I think that all this also comes with a kind of change of mind for all of us, not just the policymakers, also for us, because many times when we go to do some changes in our own homes, we don't really think that in some years we will have different needs and requirements. So I think it's also a way for us to do that personal process of thinking in the future and how we would like to live in the future. Probably for some people it can be late, because if you are in your 80s and your home is old, there are many things that you cannot implement, but at least for the next generation is something we should think on. And I would like to invite all of you to read our Vision 2040, because I think that is a good document to take into account where we identify all the different stakeholders that should be involved in this process of achieving homes for life. That sometimes we say age-friendly houses, but we refer to homes for life, a place where you can stay and live during all your life course, if that is your choice and what you want to do. And of course, from the beginning of the project, we did say that we think that this is more a policy issue sometimes than a technical issue. So we have been our little bit in this part. And we would also like to say that, of course, in the universities and in all the people that is involved in the education, all these things should be included, so that the architects and the designers take into account the needs we will have during our life. And I don't know, Regis, if you want to add something.
Yeah, thanks, Silvia. Maybe just to add that you mentioned we have guidelines, and I think it's quite important, because Homes for Life, it's not just the certification. To get it, there is a bit of work actually. You have to go through this evaluation framework. It's a lot of questions that you have to ask to yourself, and the feedback we received during the pilot phase is that those guidelines and this evaluation framework, when those stakeholders, they had to work through that, it was a way already for them to improve or to think about things they would not have thought about, So already, if you would go through those guidelines and just the evaluation framework that we implement to certify buildings, we think this is some kind of decision support as well to improve. And that's something which is public as well on the evaluation framework. So we are happy to share the set of KPIs and so on.
Thank you so much. I see Natalie has the hand raised, and before you have the hand raised for a long time. So before I ask anyone else, please go ahead and tell us.
Yeah, thank you. Yeah, Natalie Pursitz, I'm from Norway and connected to the University of Bergen. And I have a question. Thank you for your presentations. Real interesting to hear, because yeah, we have the same challenge in Norway, adopting houses to elderly. And I have a special a question to I think to Silvia and Regis about the houses or your designs. I have two questions. The one is, in which degree did you include telecare and assistive technology in your buildings? And the second is, in Norway, we have about 40% of home living people over 70 years who receive home care have dementia. And how did you solve the challenge to adapt your buildings to people with cognitive disability, which are progressive disease, in which challenges in everyday life are changing progressively? Have you had some adjustment for these buildings, or do you have some plan for this challenge? Thank you.
Thank you, Natalie.
Well, I start, and then Regis, you. Regarding the first point, that was about the assistive technologies at home, no, that's what you asked. Okay, when we talk about homes for life, we did have that kind of discussions at the beginning, but we are not defining a home that is adapted to all the needs of all the people. What we say is that the home has to have the infrastructure that makes it able to adapt to the future needs of all the people. I mean, what we say, for example, is that you have to have the technological infrastructure, so that if you want to have eHealth services or other kind of services, you can implement them in your home. We are not, let's say, the design that is that complies with the needs of all the people does not exist. I mean, because we are diverse and we have different needs and different preferences and different situations. So our intention was to take into account all that things that have to be taken into account in order to be able to adapt your home while your needs and requirements are changing. So that is why we also included that part of technological infrastructure in the category of smart readiness because of that. And regarding the other question about the people with dementia and the needs and the evolving needs in very short time, we did have one of our pilot cases is the Hogebek. That is an example of a village for people with dementia. And they did test the pilot case. And they also find it interesting. And in fact, they give us a lot of feedback. So I think that if we really are able to achieve a home that has that capability of adapting to our needs, every profile, every personal profile can have a good life in their own home. The issue is that to achieve that changing capacity in a static thing like a building or a physical place, a house, let's say. Okay. Regis?
Thank you.
No, perfect. And I have just put the link in the chat to the specific pilot site that Silvia mentioned in the Netherlands.
Thank you both. I see another raised hand from Pedro. Pedro, you want to jump in and tell us?
Yes, thank you, Karina. Well, my name is Pedro Moreno. I'm working in Finland in Seinäjoki University of Applied Science. And my question is to Silvia or Regis, because one of the examples that you presented was about an apartment that was used as a test bed. So my question is about the certification, if it is applied also for living labs, because here in our university we have let's say a premises is not a flat itself, it's premises that we have here in the university building, which we use as a living lab. It could be used for simulating smart homes, because we have all the facilities that people can find on their own dwelling, as a bedroom, kitchen, living room, whatever. Sorry. And my question is if this certification could be applied for the living labs as well. Thank you.
If the certification for 8234 Part 2 can be applied to these apps, yes. They're both to support what the EU has called citizen empowerment, and we have been in contact before with healthy and active living projects within the EU, and also the more personalized healthcare. So it's both. both target groups that we're working towards.
Okay, should I contact Regis or you, Petra or Silvia, to carry out this kind of certification?
I think that maybe Silvia or Regis also need to answer regarding Homes for Life, because these are two different things.
Yeah, well, I was referring to Homes for Life.
Yeah, okay, please go ahead.
I can start if you want to, and then Silvia, you can complete. But indeed, you're right, Pedro. And we had, among the pilot sites, we had one which is indeed a bit particular, because indeed it's a living lab, and so it's really a test bed, which is quite flexible, and it's possible to test new technologies, etc. And so, of course, the certification design is not, is more designed for buildings that are going to be actually inhabited. But we decided to include this one as well, because since it's a new certification, and since this living lab is designed to host and welcome many stakeholders, we think it's great to have it among the portfolio, especially for the promotion of this new certification. So yes, definitely we welcome a discussion with you if you have another living lab in mind, and then we can discuss together if that can be applied in your case in Finland as well. Yeah, we are happy to discuss. I put as well in the chat and the link to the business case of this one, which is a bit specific.
Okay, thank you, Dennis. Thank you.
Thank you so much to all of you. I don't know if we have more questions. I think that we could maybe take them for a while, but I give you the next few seconds to let us know. Otherwise, I think we'll look. Oh, okay, go ahead.
Hi.
Hi.
Hi, my name is Petra. I'm an architect and a gerontologist, and I'm doing my PhD now in environmental gerontology. And one of the things I've been working on is something like Home for Life, but I've been addressing also the surroundings. What do I mean? Even a good house can become a jail. For example, if you live on a mountain and in order to get out, you need to climb up a mountain to go down, if the walks are not enough. If you have, for example, they're talking, I think we talked in a few meetings ago about the 15-minute city, but does the city, the neighborhood around the house encourage physical active aging? Going out to the supermarket, going out to the pharmacy, going out to the doctor? Do you have enough greenery for people to go out to meet, shade? So when we're talking about Home for Life, I was wondering, are you also looking about all the extra activities around the house? And I would really love to collaborate, because this is my PhD and this is in my blood.
Yes, well, in fact, when we include all those clusters about personal social cluster, one of the questions we did was, does your home allow you be part of your community? Does your home allow you go to the shops? Does your home allow you? I mean, that were the questions of a home as an enable, that helps you to be able to do the project of life you have. And in fact, the other cluster, the outdoor access, there we have also some requirements regarding the distance to, let's say, shops, to culture, I don't know, libraries or whatever. Because we consider, in fact, when we talk about the home, we don't just consider the dwelling where you live. We take into account the building, but also the neighborhood, yes, the close neighborhood. We did not enter in things like transport because that are competencies of the city level, and we couldn't, let's say our scope was smaller, but we did take into account what means to have a life, a complete life, like to be able to do the things you like. That is active and healthy aging, isn't it? So yes, yeah.
Perhaps an old coincidence, Hoogwijk is actually in my hometown, and it's that definitely has a lot of facilities for people, even though they have dementia. We've had the Dutch Queen and the Swedish Queen and lots of people visiting to learn about the example, things like they have really nice things as well, like a garden with smells that people remember from long ago. So I can definitely recommend this example.
Thank you, Petra. Very nice. And well, thank you all, because we decided to put you together because we also thought that there was a lot of connections between the work and growing to have an environment that supports us to be better connected and to live better. So I do think this is the truth, and I do think that once the eHealth apps standard is completely approved, and of course Homes for Life will have much more developments in the next few months and years, we will for sure need to have an update on this and to maybe give some more time for participants to put their questions and to proceed. But now we are reaching the end of the webinar, and I would like to ask you if I can share your presentations with the participants. They asked this in the beginning. If you are okay, we'll share the PDFs. And if they have any more questions, I will make sure also to put them in contact and to create a connection between Net4H Friendly and both your initiatives. It already exists, but of course it's good to be nurtured. So I will pass the floor now, if you agree, to Willeke to make some conclusions and the closing of the session. And thank you again.
Yes, thank you very much all for your contributions, and it was a very interesting presentation, especially the interesting overview of the homes and apps that are good for citizens. It's very appealing to know what we as users, what is good or what is not so good. That is very interesting to learn, and I'm looking I was also very much pleased with the call from Yifat about the environment, that the house is not an isolated tower, but that it is part of the environment, and that is very important to have. So thank you very much for this interesting first share, I would say, because I think we will continue this conversation on the certification along our projects in the Net4H environment as well. So thank you very much, and looking forward to see you in the next meetings.
Thank you.
Very much.
Thank you. Bye-bye.
Bye-bye.
Thank you. Bye.
Thank you.
Bye.